name's Cameron Donald. I'm one of the current CA3s.
Hi, my name is Sara Nikravan. I'm one of the associate program directors for the residency and also the director for point of care ultrasound.
My name is Teresa Jiang, and I am one of the current CA3s and also one of the chief residents for the VA and Seattle Children's.
I'm Andrew Eitel. I'm one of the CA2s.
And I'm Burkhard Mackensen. I'm the chair of the Department of Anesthesiology and Pain Medicine.
So welcome everyone, and thank you so much for joining us. For Dr. Mackensen, we just wanted to ask you about what changes you're envisioning for the future of our program.
Well, I thank you for the opportunity to be here. One of the bigger changes that I see is that we're looking back on a year of work towards identifying a new vice chair for education for the department, a role that I feel very strongly is important. Unfortunately, we haven't had someone in the role for the last 6-7 years, and I do believe that this position can reinvigorate education, not just for the residency, the fellowships that we have, but also across the entire department, including all the clinician educators that do such important work to support our residency program. So that's one big change coming. There are other changes in that we continue to try to do what we can to offer new educational approaches to hands-on techniques such as point of care ultrasound, which we've implemented now more actively for our intern class, but I think there's opportunity to stretch that across the entire residency program, and then include other opportunities to learn from some of our world-class faculty.
Yeah, so that faculty includes Dr. Nikravan, who I know is working really hard on a POCUS curriculum. You can tell us more about that.
Yeah, I mean, it's been a really exciting time. In the last 3 years, we've acquired across all of the institutions probably over 10 full point of care ultrasound devices, and that doesn't include a lot of the handheld devices that we've also been able to get. We've built an online curriculum with over 10 hours worth of video lectures that are accessed not just by our residents, but also by other faculty members and fellows across the institution. It's been a real hit with the University of Washington kind of medical system, which has been really great. We've implemented a program in the intern year for one-on-one bedside scanning. So basically our interns come 2 days a week during their Jeopardy rotation on Tuesday and Thursday afternoons, and they scan one-on-one with faculty members from about noon until 4 p.m., which is kind of unheard of. It's really amazing, and that's because of the support we've had from Dr. Mackensen for this. They get about 16 hours if they're available for all of the sessions of one-on-one scanning with a faculty member that's not tied to clinical duty and can really focus on teaching them, which is pretty awesome. And that's allowed us to build our point of care ultrasound elective as well, where the senior residents join them on those scanning sessions. We have developed a faculty development program in point of care ultrasound where we're getting our faculty really engaged and up to speed in point of care ultrasound and have grown in that way. So there are lots of things. We just this year, and I think it was actually in April, we had our first ever a global point of care ultrasound collaborative where we have sessions with countries in Africa, in Southeast Asia, and other institutions in the US too, where we're sharing cases, and it's a case-based curriculum over 4 years. So we've got a lot of really great things, that have been developing each year in point of care ultrasound. Now I have a question for you guys, or y'all, I should say. What have you seen as a good change or a nice change that's come in the time you've been here?
So I'm actually really excited to take the point of care ultrasound this elective later this year. I think that we didn't get the opportunity to do that during my intern year. So we've had a lot of with the switch to having full day didactics, had a lot more opportunity to practice and actually get to try out doing point of care ultrasound, but it doesn't really replace getting more experience and more time with your hands on the probe. So I'm looking forward to having that change and that experience.
I think a big change that's going on currently is having the protected time for education and having dedicated days where we have great lectures and a bunch of attendings coming in, get some simulation time, try some maybe some cases in simulation that are designed maybe not to go optimally, and see what we do in those crisis situations, and just to get the protected time where our pager's not going off and we're not being hauled away, but we actually get to focus on getting educated.
And you get, lunch too.
For sure.
Which is cool.
Well, selfishly, I can add that having you all up on Wednesdays, class by class, rotating every week, gives me opportunity to, when I'm, up in the office, to wander over and actually have some unplanned conversations with a couple of residents here and there, and plan out something new or get some input. And also simply just get to know some of you, where we have such a large program, and I don't always get to work with everyone in the clinical arena. So I think that has been a great benefit as well. And I see how coming back in person for those Wednesday sessions has really invigorated the cohesiveness across the classes and the interaction with the faculty simply. We now get to see faces again, which is wonderful as well.
Yeah, I 100% agree. To kind of echo what Teresa said, we're very, very lucky to have Dr. Nikravan. Her
I am not paid. I'm
lectures,
just kidding.
her lectures on ultrasound are actually quite amazing. I save every single one of them and reference them all the time. But I think another nice thing is we do have built-in elective time during our final year, which I'm really looking forward to. I'm actually also taking our point-of-care ultrasound elective, which will be great. But there's also more flexible rotations that you can be a part of. I'm currently on the chronic pain rotation, and after I did my clinical obligations this morning, I actually got to go back to the OR and participate in an exit procedure, which was a really unique experience. And so I really appreciate that we have a lot of flexibility in our program during certain times to really take ownership of our education and kind of seek out the experiences we really want.
Yeah, that's really great. I think, there are so many great changes that come on board, and we have such a big program, which, actually allows for a lot of nice opportunities. One question I always get from applicants when they come to see us is, what do you think about these different sites? You have these different places you go to. So, just candidly, what do you think? You think is it an asset? Is it not? That we have a couple of different hospitals that we service that you go to as residents?
I mean, I really enjoy it. I think it's really exciting to be able to switch back and forth between the different sites, and you really learn a lot of skills in adaptability, in changing to your changing environment, and in seeing how people practice in different settings. And I think those experiences are really helpful, for whatever career you end up going into. Just the practice with seeing what's out there and seeing what's available, and then changing what you're doing based on that.
I think being comfortable in any environment is such an asset to have as a program, as an educational opportunity, whether it's a trauma at Harborview and some crash case, or here, and sometimes a very controlled environment, a controlled case, and having time to really think out what your anesthetic plan is going to be here, or getting to work with the vets at the VA too, I think is a fantastic thing. So each site, I think, brings a unique educational opportunity to the table.
Yeah, I think I've really had to grow into the switching. I think when I started, I used to really tear my hair out trying to learn each new system and kind of navigate taking care of patients in different settings that have different resources. And now I've really come to value that experience, only because a huge part of our job is actually tailoring the care we're providing, either in the OR or in the ICU, to environment you're practicing in, and I didn't really appreciate that as a more junior trainee, and now I can really start to be thinking about that. And so that's actually been a really helpful experience to start developing those skills, and it's something I'm still working on. And now I actually think it's really fun to kind of learn or be a part of all these systems and feel like a lot more comfortable going into those systems, being okay with chaos or structure depending on where you're practicing, and being okay with that.
I have a quick question. Now, the last several weeks I've worked in the general OR here and there, and that has afforded me opportunity to work with CO1 residents. And I don't know if it's me or if it's true that I feel like the preparedness by which they come to the OR seem to be a level beyond what I've experienced in the past. I don't know if it's true or just me. So what I would like to know is the following, which is, to what degree does the intern year that we offer, with all its challenges, meaning you rotate through different specialties and you're kind of with internal medicine and you're with surgery, how does that year actually help you to get ready or not to get ready for the first day that you're in the OR? I was curious about that.
I loved our intern year. I thought it was fantastic. My favorite moments were probably internal medicine and dealing with really complex patients, and then applying that to pre-oping my patients now and really getting a good understanding of what they're going through, and what could happen in the OR. And then especially here, I think the ENT program is really strong. Getting to do fiber optic scopes in clinic all the time, and then being really prepared to do nasal intubations or anything like that, I think is tremendously valuable.
I would agree with that. I think that we have a pretty broad intern year with a pretty good variety of anesthesia and non-anesthesia rotations, so that you actually have some time within the department, but you also spend time with other departments. And I think underrated thing is that spending time with other surgeons means you become friends with surgeons. So I still say hi to my Oto senior when I'm in the OR with her, and one of my good friends is one of the Oto residents who we work with together when we're on the surgical ICU. So it's nice to develop relationships with other people within your program, within the university as a whole, and then also to have more rapport with the surgeons that you're working with.
If I can just kind of piggyback on that, that's one of the things I love about having point of care ultrasound exposure in the intern year, because what I found is we do our sessions and then I say, so where are you gonna go next? And they say, oh, I'm gonna go to cardiology. And I'm like, that's amazing, because now you can go and scan every single patient. You could do a bedside CT on every single patient. And you'll be with the experts, and they can tell you if your interpretations are on target or how to optimize your images. Or they'll say, oh, I'm going to the emergency department next. And it's another wonderful opportunity to be with people who are doing ultrasound every day that you can reinforce it with. So I think it's really nice that there is this early exposure, and there are all these services that you get to kind of go and work with in your intern year. So it's just been my impression.
I think in addition, for me, a big draw to our intern year structure was the idea of just doing internal medicine for an entire year or general surgery was less than appealing to me. And so this provided a really varied experience where you could really kind of walk into every rotation and create maybe one or two goals of something you wanted to take away from the rotation, and just really focus on that and get really good at it. And I think it helped actually really direct my learning during an intern year that can be very varied with switching sites and changing services all the time. And to echo kind of what Teresa said, it's really fun to know who you're working with throughout the hospital. So now, when I'm in the ICU, I can call some of our surgical colleagues when I don't need a formal consult but do have questions, and just be like, hey, what do I do? And they're just like, oh yeah, just do this, or I'll come check it out, I have free 5 minutes. So that's really nice. And then it's so fun to work with in the OR with the surgeons you know. So you can make music requests and things like that. Yeah.
Yeah, speaking of kind of, you mentioned earlier, you're kind of, you feel differently now than you did at the start. From your perspective, what are some leadership opportunities for you as a resident? You know, do you have opportunities to serve in graded roles? Do you feel like you have opportunities to actually, you know, get involved into the nitty-gritty of the department itself, whether it's the structure or committees or other things? You know, can you speak a little bit about that?
Sure. One of my favorite things this year, actually, just starting out as a CA2, is giving breaks for the CA1s, and then they come back from lunch and they say, how do I do emergence? Or, you know, they have all these questions, and I'm like, oh, this is great. Now I get to teach a little bit, or a med student will drop in my room and we get to teach them how to intubate. I think it's a lot of fun.
Yeah, I think that like there's other opportunities for learning, for teaching and learning, and like you can get involved as much or little as you want. So one thing that I'm gonna do this year is that like the interns have a dedicated afternoon each month for learning that's protected from our department. So it's as much or as little education as the presenter wants. So they pick a topic, do some like relevant teaching for the interns, and it's also a way to like introduce them to something related to anesthesia and like get to meet other people who are in our class, in our program, who you don't spend as much time with.
Yeah, I think there's lots of opportunities. I think built into the actual residency itself, there's certain roles that you start to get to do as a CA2 and especially as a CA3 where you're essentially running the board or you're the overnight resident in charge. So you're running the board overnight, you have a more junior or same level resident who you're kind of helping directing cases, and depending on who you're working with, you're doing the full induction and really running the show. So I think that's a lot of fun. I just finished up in our surgical ICU, which we first rotate in as interns and then we return to as senior residents. So that's really fun because you're working with a lot of the NPs who taught you everything you know about the ICU, as well as our new interns, so you can teach them something and feel like you know learn something along the way. And then I think there's lots of opportunities to participate in the department or in the larger programming of our residency. Teresa is a great example. She's one of our chiefs and is doing a great job. I participate in our EDI Council, our Equity, Diversity and Inclusion Council, which is very active. They put on grand rounds throughout the year related to those aforementioned topics. We also do a review of our department to see how we're doing on different benchmarks related to those topics. And we're always kind of thinking through new things that we can provide to kind of really help create a very inclusive and diverse workforce and education space here at UW. So those are just some of the things I participated in, and there's lots of opportunities to teach as well. So there's no dearth of opportunities if you want to be involved.
And even recently with the search for Vice Chair of Education, we had residents as part of the search committee for that, Dr. Mackensen.
Yeah, purposefully tried to put that search committee together with, you know, the emphasis on inclusion, and we had not only all of our clinical sites represented, but also residents and administrative staff. There was a staff member from the administrative team representing that perspective of the residency from a different angle. And yeah, this was in a while, I think, the first completely planned public or open search to be inclusive to applicants from the inside as well as outside of the institution, and really trying to follow the best practices kind of workflow, and how do you first find out from the department what's needed, then you start obviously having a state-of-the-art job description that is inclusive of all the tasks that I see and the department needs from the person, and then coming down to looking at first candidates, and then a very kind of planned out interview process. And now we are at 2 finalists, and within the next week or so I'll get to make an informed decision, which is wonderful to see that process come through.
Yeah, and we've even had, I mean, I'm sure you all know this too, but we've had residents as part of the screening process for residency applications. So they are reading the applications and, serving in that role as well to help with the screening the applications in addition to faculty members. So we've included them kind of at our residents at the very fundamental part of, residency in recruitment and the application process. We do the CQI projects, which we've had a lot of residents contribute very positively to the department in that way as well, to help kind of change and implement best practices and make things just better all around. So it's really great. I've been at other places, and I can't say that every place does that. Which has been really nice for me to see here, that we really value our residents and their input, and we try to change things every year accordingly.
So what changes have you, what are the main changes that you've been a part of or have seen in the department that came from resident input?
Oh my goodness. Well, there's been lots of them. I mean, we have a number of quality improvement projects every year, and whether that is kind of like workflow, order sets, the way that we address certain problems that are recognized in the PACU, whether that is educational components, for example, how do we make certain initiatives that we've started more visible, whether it's something like the intern lecture series that gets put together, or how to get our residents more involved in kind of that graded approach. It doesn't come naturally to anesthesiology, right? It's not like internal medicine where you're chief in the third year and you have this team below you and you're, running the show. Like, it's just not, that specialty is not made to be that way. So there have just been so many things like that have been involved. Your work that you've done with the ADI Council has been huge. So I think that, everywhere you look, there's a little imprint. And it's about, like, how do we start these projects and then pass them on and keep them going. We did a project actually a couple years ago with one of our former chiefs where we put together basically an anti-bias training for all of our application reviewers. And all of the members, whether you were a resident or a faculty member who were involved in interviewing applicants. So it's mandatory, and you have to do it before you're able to be part of the process. And that was something that came out of involvement, engagement with a resident. So.
Yeah. Well, thank you everyone for coming to speak to us about this. It was really helpful to get all your insights and to hear your perspectives and experiences since you've been in this program. And we really appreciate all your time.
Thank you. Thanks for having us.